Good afternoon. This is Scott McGann with the Falmouth Health Department doing our weekly COVID update. It's August 21st, 2020. FalmouthMass.us is the town's webpage. It has a COVID link on it. Our email is health@falmouthma.gov, and our phone number is 508-495-7485. So let's get begin. As of August, well, actually I meant to change it up, but as of today, August 21st, there are 241 cases of COVID-19 that have been confirmed since March 19th. 2 confirmed cases since last week, August 14th to August 21st, with well over 95% of the total cases no longer in isolation. And Falmouth is approximately 13.3 of all cases in Barnstable County, with about 14 to be expected based on population, with a maximum back in early April of 23%. The VNA and the CTC, which is the state's contact tracing collaborative, and with support of the health department, continue to do the isolation and contact tracing on these cases. If you look at our weekly case trend, you can see that, of course, we had the blow up in late March, early April, and we've had some long-term care ups and things like that. But it looks like we're back, at least over the last couple of weeks, back where we were in the mid to late June to early July, where the counts were low, and that's sort of where we seem to be at right now, and hopefully keeps remaining at a low rate. Since the total beginning of the outbreak, you can see where we've sort of leveled off in our sort of curve. We've had some increases that happen through events and then leveling off, and hopefully we continue and maintain the leveling off. So that's where we are with that. This is becoming a big chart that comes out every Wednesday, the weekly update. So Mass DPH does the daily COVID update, and they also do a weekly on Wednesday, and this is where the charts get updated based on the incidence rates in each town, whether you're in red, yellow, green, or white. Falmouth for the last 2 weeks has been in the green. If we have another good week, I would think we'd be somewhere in the white at that point. We're right on the cusp now, it looks like, but we're in the green to the white, which is going to become important when we talk about school reopening, when that stuff, as that's happening. So you see some reds, and it's got to do with your number of cases per 100,000 of population. Falmouth's total count in the last 14 days is 5. Its incidence rate, the rate at which the disease is showing up per 100,000, is 1.1. We're on a lower trend. We've done 9,358 tests. In the last 14 days, we've done 1,300. That's a lot of tests. Total positive 7. Percent positivity is 0.52. So our percent is about roughly the same as it was last week. Statewide, the average incidence is 3.9, so we're roughly a third of what the state average is, a little bit more than a third. Below, their average positivity is 1.5, and so these metrics are going to be used to determine what phase the schools need to be in, whether it's in person, which is what the state recommends for white and green. Yellow would be hybrid, red would be remote. I also would like to add that where the cases come from is also important per se, because if it's in a congregate living facility, such as a long-term care facility versus the general population that is sort of out and about, then you might mean 2 different things. So you could get into if you have a nursing facility with 10 cases, all of a sudden that was obviously going to bring us into a yellow situation or more, or red. So we're at that, we're looking good right now. Also, so the cases are going to matter based on where they are a little bit as well. You have to sort of take that into consideration. But as we look as of today, our positivity rate and everything looks good, and what it was back in early July, late June. If you want to know information about the reopening of the schools, I left you can Google it, but it's Mass EDU, the Department of Education. They have all documents, so many documents, it take you a long time to read, but tons of guidance. The guidance is being updated. Like all guidance gets updated quite often, and it takes a lot of work just to stay on top of the guidance and the change in the guidance, and that's sort of where we're at right now with schools. As far as our testing rate and percent positivity, I like to show these 2 slides. This is a weekly update, so this would be updated so often. Right now, our testing rate, if darker the testing rate, the more testing is occurring, shows that Falmouth is testing well, and our percent positivity looks good. So you want the left-hand slide to be on the darker side and the right-hand side to be on the light side. for the coloring, and just to show that the number of tests or the percent positivity among tests is low. Looking at Barnstable County, there's been 1,813 cases and 158 deaths in Barnstable County. You can see where we were doing really well, say, starting of June, doing fairly well into mid-July. Then we started to go up in that mid to late July and early August. And it does look like that we've tapered back down to more of the numbers, even a little bit lower than the numbers that we were seeing in July. So that's a positive sign. Barnstable County, as of August 20th, had 3 positive cases that day for a total of 1,582. And you can look at some of the counties. This is on the daily dashboard actually now. So this is a new slide on the daily dashboard, which we'll talk about in a minute, that'll give you county by county. Again, if you haven't heard any of these presentations before, every day around 4 o'clock, a little later on Wednesday, because they're doing both the weekly and the daily, so it comes out a little bit later on Wednesdays, sometimes as late as 6 or so. At 4 o'clock, they come out with the daily dashboard, and yesterday's daily dashboard on August 20th was 262 confirmed cases, 12 deaths. It's about an average day what we'd be getting, somewhere between the 150 to 250, 300 range per daily cases. And 12 confirmed deaths. Recently, we've gone to testing capacity, has gone to a green metric that was yellow for a long time. That's been a couple weeks now. And also the molecular tests you'll see have gone up is because they're adding all molecular tests. I think what they were doing previously, it seems like they were only counting new tests. If you were getting tests on a routine basis, they're adding all your tests. And we hit over the 2 million mark for our total number of molecular tests. The molecular just means PCR test. Which is the gold standard. That's the ones that are considered whether you're confirmed. Other types of tests would be considered probable. Looking at the trends, what they've done now is they've changed the percentage. You can see that our lowest value in the 14-day span was 1.3. We're at 1.3, so it's a 0% change. So that number has gone lower, and it's also gone lower because of the adding of the additional tests that were occurring, where it was not counting towards the probability. So you need to consider like to like, so they've changed this around to show what the 14-day average has been. Also, you see the number of hospitalizations is up a little bit, up 4%. And the number's been staying right around that high 300, peaked up around, recently peaked anyway, at 400 around the 12th and 13th. Surge capacity does go up and down, and, it depends on a lot of things going on in the hospital and whether they're, there's a cluster somewhere, or they're using the hospital for sort of the other stuff that normally hospitals use, and then they had to put surge capacity in for some COVID cases. And then the deaths are a 19 based on the lowest number of, we're at 13, and we've seen some down at 11 and some at 12, and that's been fluctuating in the teens now for some time. Hospitalizations are 379. In Cape Cod and Falmouth Hospital, it's been running, Falmouth Hospital's been running between 1 and 0, and as has Cape Cod Hospital. We're down 441 from mid-June, up 30 from July 22nd, and down 22 from August 7th. Okay, that's updated on a daily basis. Intubations are down 23 from August 7th to 62, and from August 7th it's down 15 for total number of cases that are intubated, meaning on the vent is down to 23 statewide. And here's the trends showing it, dropping for the most part. Fluctuating a little bit, but dropping for the most part. Our long-term care, we haven't had any cases recently in the last week or two for long-term care. In the state, there's been 5,693 deaths, which is about almost 66% of total deaths in the state has been associated with long-term care. So that's it for the metrics. Moving on to COVID testing. COVID testing hasn't changed too much. You still could go through Cape Cod Healthcare with the phone number of 508-862-5595. That'll require a doctor's note and an appointment. It's done up at the hospital here, up at the drive-through situation over in the parking lot. Also, Barnstable's doing it, I think, still at the Four Seasons. I think they should have moved to the hospital by now. I'd have to double-check that. Also, you can get it from the Community Health Center of Cape Cod and Mashpee. You can do the walk-in clinics, such as Convenient Care MD. The East Falmouth CVS does them as well. There's also, if you want to go in, when we talk a little bit about different types of tests, there's some places around, like the place in Dennis, the Caremark, that does the antigen test. Again, you can go on mass.gov-COVID-19 testing and get the most up-to-date information on that. Types of COVID tests. Antibody detects antibodies in the blood. It's a rapid, it indicates. So antibody tests are telling you that you were previously infected. All right, it's considered a probable by MDPH. It tells you, at least 3 or 4 weeks probably ago, or sometime months ago, that you were infected. It's good if you want to use it to say that you were sick in February, early March, couldn't get a test, and you were concerned that you might have had it. An antibody test would be what you'd want for that. An antigen test would tell you that you could be currently infected. It's still considered a probable. There is some error rate to it, so it's not as accurate, but it is rapid. And so there's the benefit to that. It is rapid. It is less accurate. The state does want you to get a PCR test, which I'll talk about in a second, if you get a positive antigen test. So PCR actually detects the viral DNA. It does take at least 24 hours. The state says about 75% of all tests take 72 hours or less. It's the gold standard. It's what's considered a confirmed test, only through a PCR. That's the nasal swab going to a lab. It determines active or recent infection, very recent infection, and it's the only way to be considered a confirmed case. The world of testing is rapidly changing, and different types of saliva tests and different types of tests are out there, and hopefully we get some quicker, cheaper, faster, and accurate testing out there, even better than what we currently have, but this is what we have as of right now. Again, we're in phase 3, step 1. Gatherings order changed a couple weeks ago, limiting gatherings to 50 and encompassing more activities. Youth sports, no more than 50 people on a particular surrounding a playing surface, and no more than 25 on a field at one time. Getting back to the schools, I didn't have a chance to add a slide for that, but in speaking with the schools, their guidance is being updated daily. New guidance comes down every day. And guidance gets updated and tweaked as time progresses. And so if you need to know a specific guidance, it can all be found on the Mass DPH's website. If you need help with it, you can call the health department. We do get a lot of calls on how to interpret different types of guidance. It's kind of what we spend a lot of our time on. And so if you're infected by the guidance or going to sign up for something and you're concerned about the guidance is there. Sometimes it's a little difficult to it links up other types of guidance and other types of orders. And if you have any questions, you just can call the health department. Again, social distancing and face coverings. Mandatory face coverings on Main Street in Woods Hole, which is the Water Street, Luscombe, and Railroad Ave area. There's some signage up there as of last week. We also had the August 1st travel guidance requiring a 14-day quarantine. The health department continues to follow up on complaints regarding social distancing. Face mask complaints, we will follow up on all and any of those as we can. Again, continued diligence with social distancing and face coverings, hand washing and hand sanitizing, quarantining upon arrival, avoiding gatherings and parties, especially indoors and without social distancing, stay at home when ill, and follow the state guidance. Any business owners that listen to this should be following their specific sector guidance. And again, any questions, you can contact the health department. We've gotten into a better spot than we were a few weeks ago, where we had a couple of incidences at the nursing home with lifeguards, and those have seemed to have tailed off. They have tailed off. And of course, we just don't want to have that continue happening, especially as we're trying to get into schools. School season's coming upon us. So obviously, the last thing we want to do is undo the hard work. So it's the continued diligence with the social distancing and face coverings. It's been shown to work. It's also, a lot of studies are starting to come out to show that with wearing face coverings and doing social distancing, even if you're obtaining the illness, you tend to obtain a lower viral load. And your viral load, the initial dose that you get in you, is important in determining sometimes whether you're going to get severely ill or not. So the face coverings and social distancing seem to do a very big role in, if transmission does occur, it does occur at a lower load level, which does help the individual, generally speaking. So some of those studies have been coming out to showing that. So again, face coverings and social distancing is our key right now to maintain. Again, recap, the state metrics are flat. Data is still, I didn't cut it all off, data is still being analyzed to see if we're in the correct phase and whether we're going to move back or forward. My guess is we wouldn't move back with the current state of where we're at. We've had a good couple of weeks here in Falmouth. We maintained the green category over the last 14 days, and actually we were pretty close to being in the white category at this point. Our current level in Massachusetts is phase 3, step 1. So that's what I have for this week. And again, if you have any questions, please call the Health Department. Thank you.